pregnant women at this point, there's variants circulating, there's vaccines being administered. They need good advice. What do you mean by that? What is the, I guess, advice that needs to be put out there for these women?
So the first thing I think I want to tell women is, pregnancy is such a unknown state. There's so much anxiety surrounding it, especially for first time moms. And, couple that with the stress of a pandemic, you inevitably get women that are just a bit more anxious than usual. And I think it's just important really to remember to take the same precautions that everybody is taking outside of pregnancy, to really respect the same rules of distancing and physical distancing and social distancing, and to just be more aware of the possibilities if you are eligible when it comes to vaccination in pregnancy. And we get asked that very frequently in our offices. And you are completely right when you say pregnant women want that information with regards to what to do if they are offered the vaccine and what risks they actually have with regard to COVID in pregnancy.
So what exactly are those risks? Because we're seeing it everywhere. Look, pregnant women are more at risk. How much? I've seen 5 times more at risk. So what are you telling your patients?
So pregnant women are not necessarily more at risk of acquiring COVID. But we do know, so there actually is a Canadian report on surveillance of COVID-19 in pregnancy. And that report actually adds to the growing body of evidence that shows that pregnant women are in fact at higher risk of severe illness related to COVID. And what that actually entails is higher risk of hospitalization, higher risk of admission to intensive care units, even higher risk of requiring ventilation. On an actual obstetrical perspective, what has actually been shown Canadian wise is that there's a heightened risk of prematurity. So that risk was estimated at about 12.9% in those who had COVID, as opposed to the national estimate of about 8%. So it's not something that we can negate. And you are right with regards to the variants. We are seeing younger people and younger individuals getting affected by the vaccine and getting even more severely affected by it. So it is unfortunately a reality that we're not completely out of and actually completely in the middle of right now.
So what does that mean for, all, Quebec pregnant women who right now are watching and thinking, okay, well, my OB-GYN is telling me this and mine is telling me this. And there's is there conflicting information out there? And, what about the people who, this one woman I just spoke to says, I'm sort of helpless because I'm trying to look up information on my own. I'm not getting a full picture because we don't know as much as we should.
So I think the last year has been a learning experience for so many of us. And, news does change very quickly. But I think what we do know with regards to this vaccine is, so we do not, and I always tell my pregnant women this, we do not have clear data with respect to this vaccine in pregnancy because pregnant and breastfeeding women were excluded from the initial trials. Though what we do know is there's about 20,000 of those women who actually ended up getting pregnant surrounding the time they got vaccinated for those trials. And there was actually no increased side effects that were observed or any safety signals that were even pointed out. So that's the first thing that we've kind of managed to learn from those initial trials. Judging from other vaccines that are similar to the COVID vaccine, we would expect this particular one to have the same efficacy and safety in pregnancy. And again, important for women to realize they remained at risk if they're not vaccinated of infection with COVID, and again, of severe morbidity or complication related to the virus. So, there is emerging data with respect to the actual benefits even of the vaccine. There's a study that just came out of Harvard that showed that, the vaccine might actually even confer immunity long term to the newborn baby. And COVID antibodies were actually found within the umbilical cord in breast milk. And so we're actually thinking that maybe it actually is beneficial and confers this immunity to your unborn child and to the infant at birth, which is some of the benefits.
Does that mean then somebody who just gave birth or is giving birth now, is that too late for them? Or, can they decide, yes, in a couple of weeks, will my baby still get immunity, or is it too late?
So that's a bit of a trickier question because the time frame surrounding when those antibodies necessarily get transferred, we don't have all that data yet. So to say exactly what time period right before the delivery with this particular vaccine is a bit harder to guide women. receiving it earlier on. Most vaccines that are given are usually given around 28 to 32 weeks, and that's usually the time limit that we usually say to confer best immunity to the baby. But with regard to that, it's hard to necessarily say because we just don't have that data.
What is your overall advice now that we're seeing these highly transmissible variants, circulating? Like you said, that they're, it's mostly younger populations now being targeted by this. What do you say to that, to these moms who are expecting, they go out, a lot of them I spoke to are saying, I just stay inside as much as possible. I go out to my appointments and that's
How
about
much
it. So
Netflix could we do right
well,
now?
exactly. So what do you say to them? Do they just hibernate for 9, 10 months? Or do they just, try to live a balanced life? How can you do that though?
I think it's about living your life, but again, respecting the same measures and same precautions that everybody else is taking. It's nothing different. There's no magical solution to this, but it's also, I think right now with all the stress, it's also hard. Pregnant women need to, and that's what I try and tell them, enjoy this moment in time, enjoy this pregnancy, especially for first time moms. It's such a special moment. And I don't think, I don't want them to lose sight of that. With respect to what to do with regard to the vaccine, I can even say our Society of Obstetricians and Gynecologists of Canada have even reaffirmed their statement and said that pregnant women or breastfeeding women shouldn't be precluded from the vaccine. And so I do tell my pregnant population, I think it's a personal value choice. People have different beliefs, people have different thought processes, but I think with regard to this vaccine, extrapolating from other vaccines, we would expect good safety and good efficacy.
And the variants, just going back to that, what would you say at this point to, these mothers, well, soon to be mothers, about watching, worried just about their every move? And if I get the variant, will something bad happen to me or my unborn child? What is that overall advice when it comes to that and the risks associated with catching COVID? Because I'm seeing mothers, soon to be mothers in ICUs, right? And that's hard.
So I actually was even a bit surprised yesterday. I did my training at Mount Sinai in Toronto, one of the best hospitals I've ever worked at. And I was actually surprised to find out that 20% of the ICU at Mount Sinai there consist of pregnant population. And I was a bit floored when I spoke to the chief yesterday. And I do think, again, it's so important for us to reiterate the importance of social distancing and taking those precautions. And pregnant women should not, I'm not saying they have to be extra precautious, but they have to respect the same precautions. So it from what we've known from the beginning of COVID is pregnant women, most, again, even people who acquire COVID, do fine and have a lighter course or a milder form. Some are asymptomatic carriers that we screen for when they come in for delivery. But we do unfortunately know that they are at those heightened risk of hospitalization, ventilation requirements, ICU admissions. And so I always try and just reaffirm that they need to respect the rules and just be more prudent.
Just lastly, very quickly, the advice that you're imparting, I guess, why is that so important? Because I'm sure there are many questions about the birth and the pregnancy itself, but this is a whole other avenue I'm sure many of you have not had to explore before this last year. So it's really, why is it important to not leave these women in the dark? What are the risks of, women who are pregnant not knowing about all of these different risks associated with COVID?
I think a lot of people at the beginning of the pandemic put their pregnancies on hold because of the anxiety surrounding the unknown. And, a year later into this, a lot of people are realizing this pandemic is lasting a lot longer than all of us could have imagined in the beginning of this. And I think people are just fed up of putting their life on hold. And so, I think it's just important for them to be aware of what can be expected. And again, precautions to take. And, if they do get pregnant, know that, we're here for them. We're ready to tackle it. We've been tackling this for a year. Uh, and again, most have a milder form, but there are those heightened risks that I don't think they should be in the dark of. I think, younger people my age, younger, just feel like they're a bit immune to all this. And I feel like they think, oh, that, the severity and the complexity is really for older people. I don't have any health issues. But even more so, especially with regard to the vaccine, people who do have underlying, health problems are even that much more at risk of acquiring COVID, of complications related to COVID. And, we know even the third trimester of pregnancy seems to be a heightened period where a more complex and severe form of COVID tends to happen. And so that is even a risk factor in itself. And so I just think people need to be aware of that so that they don't forget that they are not immune to all this, that it still can affect them, that we are still seeing women in ICUs. And again, I don't want them to forget the beauty of being pregnant and forget this moment in time.